Hi all, welcome to this, the second video in our second topic in Unit 3, Health. Now in this video we're going to look at our second disease, which is heart disease. Now the first thing that we're going to look at with this disease is its distribution. Now maps like this one, by now you're reasonably used to. You've seen it crops up really frequently in the exam questions, where you look at these kind of chloropleth maps and you need to discuss what it is you see. And you can see from this map that we've got the highest rates of heart disease are in Russia, in some of the nations in the kind of Far East, Mongolia, etc., and certainly kind of Eastern Bloc Europe, and rates actually go down as we enter some of the developed world. Now this is maybe counter to what we would expect, as we have discussed heart disease as a developed world disease, where it certainly is one of the biggest killers, and while it may be more prevalent in terms of the rates of it per 100,000 in some developing world countries, it's certainly a bigger killer in the developed world. Now, where does it actually occur and what factors influence that? Now, the first thing, there's lots and lots of factors that can influence its distribution, and some of these factors are: first, lifestyle. Now, in developed countries, the pace of life tends to be faster, which means that you've got a higher stress lifestyle, and higher rates of stress are a factor that can lead to higher instances of heart disease. And we also tend to have a more sedentary work environment. So what we mean by sedentary is what I'm doing right now, being sat down at a desk, not moving around. This lowers the amount of exercise that we do on a daily basis, which again increases our risk of contracting heart disease. Diet. Now this can vary globally. Now traditionally we see that in Asian nations we've got lower rates of heart disease because they tend to have a less meat and dairy rich diet. We particularly see this in Japan, for instance. There's a lot more fish and rice and what have you, and that tends to reduce the amount of heart disease that we see in these areas. Affluence. Now again, really, it sounds really simple, but it's really important. The richer you are, the more you can buy to eat. You can also afford to buy things like alcohol and cigarettes, and all of these are factors that can lead to heart disease. Also in wealthy nations, you tend to find that the cheapest food is fatty and the least nutritious of the kind of options that are available. So people who are eating lots of cheap food tend to be increasing their risk of contracting heart disease. And all of these factors lead to increased rates of heart disease wherever we find them. Now next, so causes. And we've kind of covered this a little bit already, but when we think about the causes of heart disease, there's 5 main factors that we consider. So poor diet, like we've already discussed. High fat diets will lead to increased instances of heart disease. A lack of exercise, smoking, higher stress levels, and inheritance. Heart disease does or can have a genetic component which can be inherited. So all of these things are, some of them might seem quite straightforward, but they're all factors that can lead to an increased likelihood of you having or you catching heart disease. So not catching, it's you contracting heart disease. Now, the impact of it. Now on the individual, it can lead to stroke, angina, heart attacks, death. Are all very obvious impacts of heart disease. And then obviously we're going to find an impact nationally in terms of financing actually dealing with heart disease, actually having a system or series of systems and health services in place to manage the impact of heart disease. So if we think about the UK, in the UK we pay a total of £8.4 billion every year in healthcare that goes towards tackling heart disease. It costs us around about £3 billion in terms of lost productivity. And in terms of other costs, like family members taking time off of work to take care of people suffering from heart disease, we're looking at £2.7 billion a year. And in the healthcare sector, preventative strategies and campaigns is £0.3 billion. The work done by GPs, primary care, that comes in at £1.1 billion. outpatient care, you visiting a hospital to get some work done, to get some advice, and then leaving again, is £1.08 billion. Being an inpatient in hospital, actually being admitted, having to have surgeries, etc., £4.3 billion. £2 billion in medicines, £500 million in rehabilitation, and £1.6 billion on social services to support those who have heart disease. So you can see that this has got a huge cost associated with it that the UK has to pay on a year-on-year basis to try and deal with the impact that heart disease has nationally. We can see as well that we've got, the ultimate kind of impact of heart disease deaths. Now, if you look at this, it's a reasonably busy graph, but you can see the trend is that over time, from 2004 to 2010, where this data range extends from, we have got a decreasing number of deaths every year from heart disease. There is a slight exception in the Edinburgh line, which squeaks up, but generally speaking, the trend is going down. So, for instance, we can see, in Glasgow, that we've got a rate of 150 people, and these are deaths per 100,000 people. So, this is 150 people dying for every 100,000 people in 2004, and it's went down to, around about 110 people per 100,000 by 2010. So it's having an impact. People are still dying from this disease, but that impact in the UK and Scotland is certainly improving. It's getting better. Now, control, the last section that we think about with our diseases. Now, there are two main methods of controlling heart disease: healthcare and public education programmes. Now, to start off with healthcare. Now, and there's a lot of text in this slide, so bear with it. You might want to pause the video just to digest some of it. But, in developed nations across the world, including the UK, there's a lot of different medical options that you can take advantage of to reduce the risk of catching heart disease, or to actually treat it once the disease has manifested. Now, obviously, how available these treatment options are in any particular area impacts how deadly heart disease can be. Now, in the UK, obviously we've got the NHS that helps to try and control heart disease by providing primarily free medical checkups, and there's also advanced treatment options. Now, medical checkups are reasonably straightforward. It's going to your GP, it's seeing doctors consistently, regularly, getting things monitored like cholesterol and blood pressure. These are the early warning signs that heart disease is becoming an issue. And if these things can be investigated early and they can be tackled early, it can mean that the impact of heart disease is a lot lower and a lot more easily managed. If we get to a stage where we do need to actively manage it, we've got a huge amount of advanced treatment options, and this obviously isn't a comprehensive list, it's just some. So, there are pacemakers can be installed, artificial heart valves, defibrillators can all be installed in a person whose heart is struggling because of heart disease. If it really comes to it, the effectiveness of heart bypass surgery has increased hugely over the last 10, 15, 20 years. It's become much more effective, it's become much safer. We also have a huge amount of medication that people can be given to try and either manage heart disease or to minimise the likelihood of it. Aspirin, beta blockers and alpha blockers are just 3 examples of the kinds of medication that can be given to people with heart disease. Now, one of the other big things we have is education, so public education programmes. Now, the NHS also plays a huge role here in the UK, and they take a lot to do with educating the public about heart disease and how to minimise the impact of it and the risk of catching it. Now, the education itself takes forms, there's posters, there's TV adverts, there's stuff on social media, leaflets, the radio, etc. It's everywhere. The NHS spends a lot of money every year on trying to make people aware of the hazards of heart disease and how to avoid it. And this is obviously for two reasons. Primarily, to stop people catching heart disease, to stop people catching a disease which could kill them or severely limit their quality of life. And another way that you can look at this, and it's possibly a slightly harsher way to look at it, is that in the long run, it's saving the NHS money. We've already spoken about how there's an £8.4 billion bill for heart disease every year in the health service. And as many people as we can stop being on that bill as possible brings that cost down. So what kinds of things do we actually do? Now, there are four main bits of advice that the NHS gives out. One, eat a better diet. They give very detailed advice on the types of food that you should avoid, butters, milks, red meats, things like this, that carry a high risk of heart disease, very fatty foods. And they recommend foods that will help to lower your risk of heart disease. The things we all know we should eat more of, fruits, vegetables, etc. They also advise that you exercise more. Your heart is a muscle like any other, and the more you exercise, the healthier it will be, and it will help to reduce the risk of heart disease. Stop smoking. Smoking, again, vastly increases the risk of somebody catching heart disease, and a lot of money has been poured in to stopping people smoking. And over the last 20 years, we have actually seen this be fairly effective, and numbers of smokers has went down. Reduce stress levels is number 4. This is one of the ones in the list that doesn't necessarily look like it's getting better. So we recommend that people basically relax more. Higher stress increases blood pressure and increases your chance of catching heart disease. So if people can relax a bit more and a bit more often, reduce their stress at work, it can reduce the likelihood of them catching heart disease. And as I say, this is of the 4 on the list here, it's the one that as a country we're kind of struggling with. Okay guys, this is going to wrap up this video. This is 2 of 3 from health. We'll have one more to look at when we look at HIV/AIDS, and I will see you guys then.